across Borno working as of today. They're working in 25 teams, 8 teams as a doctor, about 4 nurse midwives, community health extension workers, pharmacists, laboratory scientists, and a data officer.
Even till now?
Oh, even up to now. The original plan was to last for 6 months, and so ordinarily we will have ended the initiative end of July. But we actually applied to the chair of the tax team, the Honorable Minister of State, to extend it by 6 months. Because we're doing so well, we're looking at the number of cases we've had. We've identified 3 major challenges there. Number 1 is malaria. Number 2, diarrhea diseases. Number 3 is acute respiratory tract infection. And we can tell you in the last 3 months, no one has died in any of the facilities for malaria.
How do you guard against cases of or challenges of insecurity?
Can I tell you the truth? We are supported by the military, the Joint Task Force, but we had an accident about 2 weeks ago. One of the delivery trucks was ambushed. We lost a driver. They stole the truck and the drugs. But that has been the only single problem.
Even with the military support?
Well, one incident in 6 months to me is not significant. Bad because we lost someone, but to me, in a place that is not too secure because we still have security challenges in at least 2 of the local governments in Borno State, I think we've done so well with respect to security. And we must appreciate the security agencies for supporting us.
How do you access children in liberated communities? You know, there are lots of other children outside IDP camps who are also malnourished.
Well, we are trying to de-emphasize working in IDPs. The state government is keen on moving people away from IDPs down to the community. So we have mobile trucks, we have logistics support, and we are moving around. So we are doing house to house, and we're cooperating with the local government chair. When we did the midterm review in Maiduguri last month, we had representative of the traditional rulers, we have local government people working with us to review what we've done in order to fine-tune and move faster if need be. So we're working with them.
How much really was expended, in this intervention?
Well, we have expended 4.3 billion naira for the health component. The chair of the task force, the Honorable Minister of State for Budget, will be able to tell you how much you expended in all. But for health, 4.3 billion.
Is it supposed to last for, you said 6 months or?
6 months, technically speaking. But the drugs in Borno State today will last them for the next 2 years. And that's why we are seeking for extension, because we do not need to buy drugs. We do not need to buy trucks. We have the ambulance, everything there. So what we needed in terms of keeping them for another 6 months will just be paying salaries of the workers who are there, the volunteers.
Of course, we don't have IDP camps only in Borno State. Is that just a focus for the ministry, or you're looking to extend this?
Well, this is like a phase 1 of a robust initiative. We've also done a state-specific plan for the 6 states in the Northeast.
What states are those?
Yobe, Adamawa, Gombe, Bauchi, Borno, and I think Taraba. 6 states. We've costed it, but we're perfecting what we are. I was challenged pleasantly by the governor of Yobe and Adamawa 2 days ago. Say, Honorable Minister, we're expecting you. I was in Yobe last year, and interestingly, described as the first federal health minister to visit Yobe since it was established. So this administration is not going to leave out any state. We are committed to developing the country evenly, and we are going to work in the other states. But there is a lot of need in Borno State compared to the other states. I think the real epicenter of the insurgency is Borno. Yobe is also affected. Adamawa is affected. But I think 60 to 70% of attention should go to Borno State.
Do you get the sense that the Borno State government is pushing so much effort into this as well?
Let me openly commend the governor. He's been an outstanding administrator, very compassionate, keen, interested, committed. He's done excellently well, in spite of the challenges. And we are receiving tremendous support. And we also received tremendous support from traditional and local government chairmen. They were all present at the midterm review meeting.
You see, the last 2 years have seen outbreak of diseases, you know, and of course the last of which was meningitis, which is thankfully over. But is this really something that can be curtailed, you know, or is it a lack of attention, adequate attention or infrastructure, you know, from the government?
Well, let me admit openly that one thing is certain: we will have many more emergency outbreaks. That this is an acceptance globally. We're having global warming. When we did not have outbreaks in the past, we now have outbreaks. Global warming is contributing significantly to many of these outbreaks. So the saying among many of us, public health advocates, ministers, is that there will be an outbreak. What we cannot determine is where, when, and how, and the scale of the outbreak. So we're prepared. For Nigeria, certain outbreaks are fairly predictable. When the rain season comes, we will expect cholera. When dry season comes, we will expect Lassa fever, meningitis. So and then measles. So we are fairly certain that some of the things will happen. But what we need to do is to strengthen the health system. When outbreaks occur, it is suggestive of a weak health system. The health system in Nigeria needs to be fixed. We're committed to that. And when it is fixed, not just by federal government alone, but by federal, state, and local government, then we'll have a health system that can react, that can predict, that can detect, that can diagnose and respond to outbreaks. When you respond promptly, you can really convert those outbreaks to simple occurrences. We had meningitis in Kaduna State, but because Kaduna has a robust health system, relatively compared to many other states in this country, Kaduna has one of the best health systems in this country. State level, Kaduna was able to mop it up. We had 1 or 2 outbreaks in Ibadan or your state, nipped in the bud. All
right, we'll talk about core members and the NHIS program after the break. We're still with the Minister of Health, Professor Isaac Adewole. Join us again after now.